I'm Dr. Cassie from Vetfolio and the host of Vet to Vet. Today's discussion revolves around rabies as we prepare to recognize 2023 World Rabies Day on September 28th. Coordinated by the Global Alliance for Rabies Control, World Rabies Day is an international program that aims to raise awareness and advocate for rabies elimination globally. Here to share a unique look at rabies and rabies vaccination in the United States is Dr. Richard Ford. Dr. Ford has extensive experience in infectious and zoonotic diseases. He's currently coordinating a national rabies awareness program to educate practicing veterinarians on the must-know facts, of which there are many, concerning rabies laws and regulations on a state-by-state basis. Dr. Ford, thank you so much for being here with us today.
Oh, thanks for the invitation, Cassie.
We are so happy to have you here because there's a lot to know about rabies and rabies law. While it's not really prevalent in the United States, from a global perspective, rabies is regarded as a major public health disease. So can you summarize some of the key facts surrounding rabies infection as it's recognized outside of the United States?
Cassie, this is, I think, one of the important factors concerning rabies. It accounts for many years, at least 59 to 60,000 people die annually of rabies, and those are probably underestimates. The countries most likely affected include Africa, certainly Asia, particularly India, and South America, but certainly many other countries are affected as well. Interestingly, 80% of human fatalities associated with rabies occur in underdeveloped countries. And what highlights this is that rabies vaccination of animals and treatment programs simply aren't available in these countries. Another important global fact is that probably 50% of the fatalities associated with rabies occur in children under 15 years of age. So it's a very significant issue globally. Now, what really stands out in my mind is that from a global perspective, 99% of the human deaths caused by rabies virus are associated with dog bites. That's not the case in the United States, but outside of the United States, the dog represents the primary vector for transmitting rabies. And the irony is it's preventable.
Absolutely. And that's what's so heartbreaking is talking about that many deaths, and especially in children, for something that is very preventable. So kind of along those lines, talking about the occurrence in other countries, I understand the World Health Organization has recently designated rabies as a neglected tropical disease. So can you elaborate on that a little bit more? What does that designation actually mean?
This is actually a fairly important and relevant designation. The term neglected tropical disease applies to about 20 infectious diseases globally that occur mostly, not exclusively, but mostly in tropical climates. Now, there is rabies in Alaska among the Arctic fox. That's certainly not a tropical environment, but it still counts as a neglected tropical disease, if you will. What's important about the NTD designation is that these diseases occur mostly in underdeveloped countries and territories throughout the world, and they disproportionately affect women and children. So it's an important concept considering that over 1 billion people in the world are affected by neglected tropical disease risk. Now, let me clarify, the term neglected really applies to the fact that the disease occurs primarily in underdeveloped regions of the world, where treatment programs and rabies prevention simply doesn't occur or is very limited in scope. But it's important, I think, to note that the NTD designation really is intended to target these specific diseases with increased educational support and funding. Now, the World Health Organization has a very ambitious role to eliminate canine-associated human rabies deaths globally by 2030. A lot of headwinds there to deal with, but that's the goal. And the designation is intended to facilitate reaching that goal.
That makes sense. I love that ambitious goal, and hope to be as veterinarians. I know many of us play a big role in helping to support that goal. Right. I also love that you referred to it as NTD. Of course, as veterinarians, we love our abbreviations. So to have a new abbreviation, that was one I was not familiar with. So a neglected tropical disease, it sounds like carries a lot of weight and a lot of importance.
Exactly.
So thinking back to North America here, and the risk of human rabies here in North America is significantly lower, thank goodness, but the stakes are still exceptionally high if infection does occur. So how does the epidemiology of rabies differ in the United States today compared to the global perspective that you just described?
Well, it varies dramatically. In the United States, prior to 1950, rabies in dogs and human fatalities from rabies was relatively high. During the late 50s, 1960s, rabies vaccination programs were implemented in the United States to encourage and promote and even require canine vaccination. That by 1960, over the period, has had a dramatic and sustained impact on the incidence of canine and human rabies in the United States. So right now, today, the surveillance studies show that approximately 2 to 3 people annually die of rabies. And these are not transmitted from dogs or cats, but they are transmitted by, and I think most veterinarians are aware, this is the bat. And in the United States today, it is estimated that about 1 to 3% of all bats carry the rabies virus. So we haven't really seen rabies transmitted from dogs or cats, although the risk exists. It's really limited to the bat. But what's interesting with regard to the human deaths associated with bat bites in the United States is there appears to be a significant lack of awareness that bats carry rabies. A lot of these case reports of people who contracted rabies and died following bat bites were aware that they had been bitten by a bat, failed to act on it due to their lack of awareness that bats can transmit the virus. So it's an important role, I think, that veterinarians have to encourage awareness of these kinds of things. Now, Cassie, I think you know, and most veterinarians know, that any mammal can actually develop rabies, but not all mammals can actually transmit rabies. In the United States today, the CDC surveillance has shown that for the last several years, a little over 4,000 animals have been confirmed rabid. Now, the irony here is that these are the confirmed cases. We don't know the absolute number. I'm sure it's much higher than that. But while there's somewhere around 4,000 or a little less than 4,000 of these animals are wildlife, and this includes, of course, the common vectors in the US, raccoons, skunk, fox, coyotes. Those are the primary terrestrial vectors for that. But among the domestic animal species, it turns out that there's about, interestingly, 400 or so domestic animals. And what's catching is the fact that 250 to 300 of these confirmed domestic species are cats. So the cat rabies outnumbers dog rabies, and it has by a factor of 4 every year since the mid-1980s. So if you sit back and look at this critically, you could say we could probably do a better job vaccinating the cat population in the United States and minimize that risk associated with feline rabies.
Dr. Ford, those are some really powerful numbers that you put out there that, everything from we're talking 50 to 60,000 people dying globally of rabies, but you're talking about 2 to 3 in the United States. So, I
Right.
think that paints a powerful picture. And then, even saying 4,000 animals in the United States and 400 domestic animals. I mean, that's actually like a pretty substantial statistic. We're talking about 10% here.
Well,
Um,
and yeah, you're right. And those are the ones we know about. What about the
Right,
ones we don't
exactly.
know about?
And then for the cats to outnumber dogs 1 to 4, I mean, I think it makes sense because we don't see cats in practice quite as often as we see dogs. And it really speaks to something I think we know as a profession that we need to do a better job with these cats, just overall getting them seen and really focusing on that preventative care for them.
Well, it is. And I think owner awareness of these facts is an important role the veterinarians have in educating the public and cat owners, particularly. It's a good idea to get your cat vaccinated. Interesting statistic, Cassie, Texas has for years, had the highest number of wildlife and domestic animal rabies cases each year, but it's Pennsylvania that has the highest number by far of cat rabies.
Wow.
So it's interesting how the distribution plays out, but there's quite a bit of cat rabies in southeastern Pennsylvania.
Southeast, who knew? Now I have more questions of what's going on in southeastern
Yeah,
Pennsylvania.
exactly.
So, this is kind of a scary conversation we're having here with the seriousness of this disease. And shockingly, despite the high stakes that we're talking about here, I think we're really fortunate to have a relatively low incidence of rabies in the United States compared to worldwide, because news to me, there's actually no recognized laws or regulations regarding rabies prevention and control in animals in the United States. So, can you talk about how rabies laws and regulations are developed and how they're managed?
Yeah, Cassie, you're exactly right. There is no national law. In fact, that's an interesting misconception among several of the veterinarians I've spoken to, but there are no national laws that address rabies per se. But rabies laws and regulations are generally established at the state level and in some cases the local level. Local jurisdictions, meaning cities and counties within a state, may have their own laws that are different from the state. The authority behind rabies laws and regulations is generally relegated to the departments of health within the state. Now, there are other agencies in some states. For example, the Department of Agriculture may own rabies law in some states, and that does occur. But generally, in most states, the purview of rabies law is relegated to the state public health veterinarian. They're the lead person. They're the go-to person on rabies in most states, not the state veterinarian. So there is a difference there. One important point is that even if a state does not have a rabies vaccination law in place, rabies laws are in place. And veterinarians are expected to practice within the context of those laws. So it goes beyond just rabies vaccination. But what happens if to a dog that is exposed to a rabid something, raccoon, coyote, what have you? Or what about human bites from animals that are vaccinated versus not vaccinated? So these laws are still in place in virtually every state. The authority to administer rabies vaccine in the United States is very strictly defined at the state level, and it's generally limited to licensed veterinarians. There are some states that allow persons working under the direct supervision of a licensed veterinarian to administer rabies vaccine, but it is very important to understand that this authority is delegated by law. Do not assume the law. Compliance with rabies vaccination in the United States is the responsibility of the pet owner, not the veterinarian. You can't mandate somebody get a rabies vaccine for their dog. But The veterinarian under law is expected to be familiar with the rabies law that are in place where they practice and practice within the context of that law. These are very important points and the reason that we're putting this rabies awareness initiative together.
It sounds like we really need this rabies awareness initiative because there's so much variation. So having a resource where we can really figure out what the variation is state to state and make sure that we're being compliant. I think I went to one of your lectures at the AVMA at one point, and you were talking about if your state says that somebody under your supervision is not allowed to give it, it's a veterinarian that has to give it, then a veterinarian has to give it. And man, that has stuck with me for years, where it'll be, oh, can I just give it real quick? I said, no, I have to give that vaccine.
That's true. That is very true.
And just to clarify something you said, so the authority on rabies vaccination is the state public health veterinarian, not the state veterinarian. Is that correct?
That's correct.
Okay, perfect. Well, talking about the state public health veterinarian, the National Association of State Public Health Veterinarians publishes a compendium of animal rabies prevention and control. Can veterinarians refer to that document for extra guidance on rabies law?
Cassie, I think this is an important question, and it's also a source of confusion among practicing veterinarians. The rabies compendium, as I call it, is a document that's published every few years, updated every few years by the National Association of State Public Health Veterinarians. In and of itself, the rabies compendium, although it's published in the AVMA journal, is not statutory. The compendium is designed to advise state public health authorities on the interpretation and implementation of rabies laws. Some states accept this as law and implement that. Many states do not. They will have laws that are different from what the recommendations by the compendium stipulate. And I think it's very important to understand that the rabies compendium never does replace state law. And while you can refer to it and portions of it may be included in state law, that in and of itself is not a legal document. And you cannot use that to interpret state law and make patient management decisions. Very important.
That is really important. What are there? This might be too broad of a question here, but are there reasons why states would differ from what the compendium recommends?
Yeah, why don't we have a national law regarding rabies? And that's come up quite often. But I think the reason we don't is that it's a public health issue relegated to the local or state level. The issue with a national law means national enforcement of that law. And I don't see that happening ever. The problem, and you've highlighted this very nicely, Cassie, is that there is tremendous variation in rabies law among the various states. And veterinarians who are familiar with law in one state or where they went to veterinary school may be practicing in a different state with different laws. And it's very important never to assume the law. You must know what that is.
Yeah, I think you've done a great job of driving that home and really making sure that we are familiar with the laws in our state and that we're being compliant with that. Would it be correct to say that some states, I don't know what the law is in southeastern Pennsylvania, but that some states maybe don't have a requirement for rabies vaccination in dogs, cats, or ferrets? I know are one of the other species that's labeled on the rabies vaccine.
You raise an interesting point, and I find that a lot of practicing veterinarians aren't aware of the fact that not all states even have a state law. All states have laws, but it is not a requirement to vaccinate dogs and cats in every state. In fact, there are 11 states that have no law whatsoever. Now, these are mostly in the Western United States where the incidence of rabies is particularly low. And I think this takes the burden off the state of trying to enforce a law that has minimal impact. There's only one state, interestingly, and that's Ohio, east of the Mississippi River, that doesn't have a rabies law. Ironically, Ohio is positioned to the west of Pennsylvania, which has the highest incidence of cat rabies in the United States. So you see the disparity somewhat in the logic of where the rabies laws are and where they are not. But the other ironic thing is, and this is relevant to any practicing veterinarian, is that within a state, whether or not they have a law regarding rabies vaccination, individual jurisdictions, cities or counties, in other words, may have their own laws that dictate how a veterinarian and a pet owner should have their animal vaccinated or managed in the case of exposure or a bite wound or what have you. And the irony here is that state laws can differ from local laws. That gets confusing. It's important, I think, to realize that the state laws are kind of the baseline of this. Individual jurisdictions, cities and counties, can enforce stricter laws regarding rabies, but they can never impose laws that are less stringent than state law. So you will see some variation. And what we've been able to address, Cassie, are state level laws in our initiative, trying to narrow this down to individual jurisdictions is virtually impossible. I've found that in some states, and this is where it gets very complex for veterinarians, there are counties that have laws that are different from the state, but there are cities that have laws that are different from the county that the city is in. So the client lives in the city but sees a veterinarian in the county. Which laws actually apply? That can get very confusing for the practicing veterinarian, and there's not a lot of clarity on this. It's a point that I think could be rectified in state law.
It can be really hard to keep all of that straight. So, thinking with that in mind and trying to keep all of these different laws straight and making sure that you're being compliant, you've recently launched a rabies awareness initiative for veterinarians practicing in the US. And part of that initiative includes the development of rabiesaware.org. And so what's the purpose of this site? And I'm hoping you're going to say it's to clarify some of these questions that inevitably will come up.
Yeah, well, you're exactly right. It's become very obvious to us that rabies laws are imposed at the level of the state and local jurisdictions, as we've already discussed. But the really key factor is that rabies laws vary in some cases dramatically from state to state. Yet the obligation of a veterinarian to be familiar with the laws in that state and practice within the context of that law is still in place. Now, we have done a number of reviews of state laws. I will tell you, Cassie, finding those laws online is probably one of the more daunting challenges that a veterinarian can face. Some states do a superb job of developing a rabies control manual that is applicable to any practicing veterinarian dealing with companion animals and giving rabies vaccines. But not all states do this. And the laws are all over the place. They're very difficult to find. And always, and you can relate to this as a clinician, you need this information now. You don't have time to always go back and ponder the internet for about an hour looking for an answer to this. So the objective of this website, rabiesaware.org, is to give veterinarians rapid access to key legal facts in a question and answer scenario-based presentation. It's very readable, very accessible, but it addresses about 30 or so of the most common questions pertaining to rabies that a veterinarian would encounter in clinical practice. And I think the value of this is that it not only gives you rapid access to this information, but each of the responses is validated by the state public health authority who owns rabies law, usually the state public health veterinarian. So we don't want veterinarians to be in that awkward position of making a decision, a critical decision like euthanasia versus quarantine on an animal when you're really not totally familiar with the law. Regretfully, this has happened. Veterinarians have made egregious mistakes based on their assumption of law, only to discover later, no, that wasn't the correct response or the correct management recommendation. Because you're imposing, I think it's fair to say, you're imposing a pretty significant burden on the client, which may be a 4 or 6 month isolation or quarantine at their expense for an animal, but you need to know when that type of law applies and when it does not.
Wow, I'm so glad to hear that there's a centralized resource that will be able to consult and get some of these questions answered, because like you mentioned, these are hard-hitting questions that have very serious consequences. And so, having that confusion and not having the information at our fingertips can be really detrimental to our careers, to our patients, to our clients. So glad to hear that there's a centralized resource to try to clarify some of these questions. Can you share a few examples, and I feel like there are probably many, of rabies related questions that veterinarians might not know the answer to, and they might need to consult rabiesaware.org?
Yeah, we've had a lot of fun. I will say that giving this as a lecture to an individual, a group of veterinarians in a particular state has entertainment value, to say the least. But the fact is that there are some interesting questions that I've learned that veterinarians are really unaware of. I think one of the ones that come to mind right away are who's authorized to administer rabies vaccine. This is a point that has a basis in law. It is the veterinarian's responsibility to practice within the context of that law. And we find that, yes, it's a licensed veterinarian. In virtually all states, is the primary person authorized to administer rabies vaccine. Some states, that veterinarian must be licensed and accredited to give a rabies vaccine. You can't just be licensed. Some states allow a technician working under the direct supervision of a veterinarian to administer rabies vaccine. And get this really surprised me. As we do the deep dive into state law, there are a few states that allow the pet owner to vaccinate their own dog against rabies and certify that. So you see where it becomes important to be aware of who can and who can't give a rabies vaccine. Now, that's one. The other one that I find is particularly important and has had some legal ramifications for practitioners is the fact that rabies vaccination compliance is really something that centers around what's called, is the animal currently vaccinated? That is a legal use of terminology in virtually all states. States do not refer to a vaccinated animal as immunized or protected. That does not appear in statutory language, but it does refer to currently vaccinated. So it becomes an obligation of the veterinarian to know what a currently vaccinated dog or cat or ferret is or isn't. And what I find intriguing is that to be currently vaccinated, a dog, cat, or ferret must have been vaccinated with, number one, a USDA licensed vaccine. And in Florida, a lot of military members who are deployed will come back into the U.S. with a dog or a cat that is actually vaccinated outside the country. That doesn't count. They must be revaccinated to be currently vaccinated. And it must be administered by an authorized person. We discussed that. And this is important, Cassie. To be currently vaccinated, a dog or a cat must be vaccinated at the appropriate age interval, and hear me on this, dose. I can't tell you the number of veterinarians that come up to me after a vaccine lecture and say, hey, doc, you know those little dogs? I give them half a cc of rabies. That's okay, isn't it? The answer, no, it's not. It's actually illegal, and that dog is not considered to be currently vaccinated if you're reducing the volume of a 1 ml dose to a half ml or less. So be aware of that. And then here's a third one that I'll just mention quickly, and that is that a lot of veterinarians aren't aware of the fact that when you give that initial rabies vaccine, say, for example, to a 12 or 16-week-old dog or a cat, the state does not recognize that as immediately currently vaccinated. So it's important, I think, to know when they are currently vaccinated following that initial rabies vaccine dose. And it varies from state to state, and it can vary from 14 days to 28 days, as you know, in Florida, to as much as 30 days. So it's part of the law that I think is important for veterinarians to be aware of.
Yeah, it's definitely not as simple as just make sure they have a rabies vaccine on board. There's a lot that goes into making sure we have a pet who is currently vaccinated. And kind of along those lines, I feel like the answer to this is going to be that there's a lot of state to state variation. But thinking about these currently vaccinated dogs and cats, or maybe dogs and cats who aren't currently vaccinated, and bite wounds to humans. So, how do state laws address management of a pet that bites a person?
States are remarkably consistent on this point. And I will say, Cassie, we've reviewed all 50 states and major jurisdictions like Los Angeles and Washington, D.C., and New York City. They all have laws that address human bites from dogs, cats, or even ferrets, or wild animals even. Now, what's interesting, there's a fair amount of misconception within the profession regarding the interpretation of the law. And unfortunately, there is assumption of what the law is rather than acting on those assumptions. While there is some variation in state to state requirements regarding animal bites to humans, virtually every state says the same thing. It mandates a 10-day quarantine or isolation period for an animal that bites a person. And Cassie, what's critical to understand is that is regardless of their vaccination status. The state doesn't care if they've never been vaccinated. It's a 10-day quarantine. The reason for that 10-day quarantine is the fact that in rabies virus biology, dogs and cats that are rabid only shed virulent rabies virus within the last few days before the onset of signs. So if a rabid dog or cat goes into a 10-day quarantine, they enter the quarantine healthy and they exit the 10-day quarantine healthy. They're still rabid, but they weren't shedding virus at the time of the bite. Now, one issue that has come up just recently, and it's been an important issue, is for veterinarians to understand that public health makes the call. If it is a particularly bad bite to a person involving the head or neck, public health can trump the law and mandate euthanasia and testing in a particularly serious bite injury. So veterinarians' responsibility is to report that. I want to make one clear point. Has been done incorrectly, inappropriately. Veterinarians have made the decision to euthanize a dog following a bite to a human when the dog was not currently vaccinated at the time of the bite. That is not the law. Don't assume the law.
Right. And that would be public health to make that determination. And when you say public health is going to own that, we're referring to the state public health veterinarian.
Exactly.
I'm slowly connecting all the dots here.
Yeah, that could be delegated to local public health authorities, but generally the ruling authority falls under the purview of the state public health veterinarian.
Okay. Okay. And it's good to know that there's some consistency there when it comes to a human receiving a bite from an animal. Can you, on the other hand, give us some examples of rabies laws for which there are considerable state to state variations and
Yeah.
therefore a greater opportunity for mistakes to be made?
Yeah, this is really relevant, Cassie, and I think it's one of the motivating factors behind putting the effort into this rabies awareness initiative that we have. Let me give you one example: is a pet exposure to a known or suspect, underlying suspect, rabid animal. You don't have to confirm they've been exposed. The issue is that who makes the call? You're the examining veterinarian of a dog that had an encounter with a raccoon, which you probably see in Florida.
Oh, yeah.
And it's not the examining veterinarian that makes the exposure call. It's actually public health. So once a dog or cat is determined to be exposed, rabies law kicks in. And the rabies laws are rather complex in that, is the dog currently vaccinated or not? If they are currently vaccinated, generally it's a 45-day quarantine or confinement, and frequently that can be at home. But if they're not currently vaccinated, number one is euthanasia. Big difference. If the owner declines euthanasia, there are options for a quarantine, and this is actually a strict isolation period of 4 to 6 months, depending on the states. But the states have added another variable to this equation in that they're saying, well, if the dog is overdue for a rabies booster when it's exposed to a suspect rabid animal, but the owner does have documentation of prior vaccination versus the dog that's overdue and the owner cannot produce documentation. So the laws have gotten somewhat more complex on this regarding patient management. And I think this is one of the advantages of the website in that it addresses this on a state by state basis. Let me give you a couple more examples of these variations. One, a big misconception in our profession is, do you or don't you have the authority to exempt rabies vaccination requirement based on medical concerns? A dog has a chronic illness, Cushing's disease, or it's undergoing cancer chemotherapy, chronic kidney disease. Do you vaccinate them? Most states do not allow exemption authority. Now, as you know, in Florida, they do allow you to make that decision at the time of the examination. Most states do not. Some states have very strict requirements on that, in that you have to apply for the exemption to the state public health authorities. So this is another thing you never want to assume. Another example that we see, and this is a big issue for you, is in the state of Florida, can you vaccinate hybrid dogs and cats? Can you do the wolf dog? Is it allowed? What I find intriguing is that the variation state to state is dramatic. Florida, for example, actually encourages vaccination of hybrid species that are legally owned by individuals. Some states do not restrict it and allow it. Many other states actually prohibit vaccination of hybrid. Any wolf dog or Aussie cat, what have you, cannot be by law vaccinated against rabies. And this has a basis in law. You got to know the law. And the last one that I think can get very confusing is the overdue patient. We've seen a lot of this with the pandemic. Dogs are coming in late. They're 6 months overdue for a 3-year booster. What does state law stipulate regarding which vaccine do you give? Do you need to give 2 vaccines? Do you start this 2-dose series a year apart over again? Or can you give a 3-year labeled vaccine? This varies from state to state, and it's important to know what the correct answer is. All of this is identified state by state on the website.
Wow. And thank goodness for, like I said, having that centralized resource, because I know I didn't realize the large amount of variation state to state and all the questions surrounding rabies vaccines and rabies exposure and all these different things. So my head, I'll be honest, my head is spinning a little bit with all this information. And I'm definitely going to spend some time on that website, digging through Florida's requirements and making sure that I'm familiar with all of this. So, Dr. Ford, thank you so much for joining us today. I think you've done an amazing job of illustrating all of the variables that go into rabies control in the United States and worldwide, and why it's so important to make sure that we're familiar with our state laws and state authorities. So thank you so much for joining me today.
Well, thanks, Cassie. I really appreciate the opportunity to kind of address rabies, the variation within rabies laws throughout the United States, and the impact it has on practicing veterinarians. And I'm hoping that the website will serve as an important resource for practicing veterinarians to quickly access validated responses to several questions concerning rabies and rabies management in practice.
Absolutely. Well, thank you so much. This has been such a great talk.
Well, thanks. Appreciate it, Cassie. Look forward to the next time.
Me too. And thank you to Beringer Ingelheim Animal Health for sponsoring this edition of Vet to Vet. Check out vetfolio.com for more of our B2B discussions on various topics in veterinary medicine. And remember, if one animal is better off because of you today, it's a great day.